Good morning. If you are on the West Coast like we are, welcome to Maintaining Your Brain Health. This is a community dementia education program of Alzheimer's San Diego. We are a local independent nonprofit headquartered here in San Diego, California. We'll tell you a little bit more about ourselves and the wide array of free support and services that we offer to people who are affected by Alzheimer's disease and other types of dementia at the end of the program. But first, let's get to it. My name is Amy. I am the Director of Education here with Alzheimer's San Diego. Delighted today to be joined by a few of my colleagues. Notably, Nellie Hernandez is a dementia educator on our team here at Alzheimer's San Diego and will be co-presenting the program with me today. Welcome, Nellie.
Good morning, everyone. Welcome. Thank you for being here and looking forward to sharing some information for all of you.
Thank you. We also have with us Ellen. Ellen is a social worker on our clinical services team. Good morning, Ellen.
Good morning, everyone. Good to see you.
We can't see you, but we know you're there. We can see your names. So we're happy that we're pretending that we can see you. We're really glad that we can connect with you this way via Zoom. Ellen is a social worker on our team and will be behind the scenes, but coming back and forth a few times during the program to help out with the Q&A. Here's our agenda. Here are the things that we're going to talk about. And I want to just pause and say this program is really for everyone. If you are a person who is living with Alzheimer's disease or another type of dementia, mild cognitive impairment, you're living with symptoms, but you don't know, you haven't received a diagnosis or yet pursued that, or you're perfectly healthy and you are concerned about your memory. What we're going to be talking about here today is broad in scope and really applies to anybody with a brain. So we're all here. We're all in making an effort to keep our brains as healthy as possible. Even people who are living with Alzheimer's disease, other progressive types of neurodegenerative disease, at every stage of the disease process, there are a lot of perfectly healthy brain cells, billions of them, in fact. And so our goal is to help keep what's healthy, keep it healthy, and maintain as much as we can. So we're going to talk about the key factors in healthy aging broadly, putting brain health in the context of the whole body. Then we'll talk briefly about the symptoms of dementia and how they're different from normal age-related changes. Many people who are concerned about their brain health they're concerned because they've been noticing some changes in themselves and they're struggling to understand, is this something I should be worried about or is it not? So Nellie will review the symptoms of dementia and how they're different from the types of changes we can all expect to see as we age. And then we'll spend most of our time today focused on what is known, what lifestyle factors contribute to a lower risk of developing cognitive decline, and specifically of lowering your risk of developing Alzheimer's disease and other forms of dementia as you age. So I'll start things off here talking about the key factors in healthy aging. And again, I just want to say when we talk about brain health, it's very important to think of it as an organ like any other in our body, right? It's been aging at the same rate as everything else. But the thing about the way our brain changes and the way that our brain ages, it's hidden from us, right? We don't see it ever. We don't feel it until changes are significant, right? But those changes have really been happening from a pretty young age for all of us. So I like to just sort of run through, again, kind of put it into some context. All of these systems that you see on the screen here, if you're able to see this screen, these are other organs and systems within our body that change as we age. Our muscular system, our skeletal system, we do lose muscle mass as we get older. Our skeletal system changes. We lose bone density, we lose some flexibility, some mobility. There are certainly, let me just backtrack and say, there are things we can do to mitigate some of these changes, but they are normal. We wouldn't be surprised to see somebody's bone density or muscle strength or muscle mass decrease as they age. Our cardiovascular system changes, our heart enlarges a little bit, and our whole system, our blood supply throughout our body just becomes a little bit less efficient. Again, this doesn't happen to everyone, but it is something that is normal and to be expected. Digestive changes, right? Changes in how our body digests food, our propensity for things like indigestion and constipation, right? Those types of things change. Our sensory needs or our sensory abilities. Many of us start to need assistive devices, right? Hearing aids, eyeglasses, our sense of smell and taste might change. Just our perception overall does diminish a bit. And of course, our skin is our largest and certainly most visible organ, and it definitely changes as we age. We're all very aware of these changes. And the thing is, our brain has been changing as well. Our brain is at its physical peak in terms of its size, its volume, how quickly it works, how quickly it does its job, how quickly we process information and learn new things. Its peak is really at a pretty young age. We're in our late 20s for most of us. Every person's a little bit different when our brain is at its sort of physical peak, but by no means is that when our brain is at its actual peak in terms of its function and how we use our brains. We actually get better at that continuously throughout our lives, right? As we're gaining perspective and insight and knowledge and wisdom. But physically, our brain really does begin to decline, if you can frame it that way, from a pretty young age, early 30s on. We lose volume in our brain. Brain cells die. There is evidence of the brain's ability to create new brain cells, but overall, a loss of volume is normal as we age. We do see less connection between the neurons, the nerve endings at the ends of our brain cells. That connectivity, a synapse, that's sort of the basis for everything our brain does. Memories, movements, voluntary things that happen in our body, as well as involuntary things, involuntary functions. A reduced blood flow. Remember the changes to the cardiovascular system that are normal. Your brain is a big user of your blood supply. And so as your cardiovascular system changes, we will see less blood flowing to the brain naturally, right? There's also gravity at play. We tend to be a little more sedentary, lots of other reasons that happens. So those physical changes that we cannot see over time, eventually they add up and they reach a point where we do notice some cognitive changes. So again, these are normal changes to be expected. So mild memory decline, and I mean global memory decline. It's your memory of things from a long time ago, as well as your memory of things from a couple of days ago, becomes equally less sharp, right? But it's mild. It's not interfering with your daily life. It's an annoyance, to be sure, but it's not something that is not expected. Nellie will give you some more examples of this when we get into the symptoms. Our ability to control and maintain our attention certainly changes over time, right? I'm much more easily distracted now in my mid to late 40s than I was 20 years ago. That is absolutely true. I have noticed that change significantly, right? Being able to drive a car with people talking to me, I'm much more like, please, hold it down for a few minutes, please. I'm trying to concentrate. I didn't need that 10, 20 years ago. Right? So those are things to be expected. A slower ability to process information. Anybody who in mid to late life has taken on the adventure of new learning, right? Going to school, or even just something like learning a new language, learning to play a musical instrument. When our brain is healthy, we absolutely can do this throughout our lifespan. But we do it much more slowly and later in our lives. When we are young and our brains are very, what they call neuroelastic, right? They make connections very quickly. They find workarounds. They retain information so much better than they do when we are older. These are just normal age-related changes. And there's plenty of evidence about things we can do to maintain as much of that neuroelasticity as we can, but some changes are simply to be expected. So lots of factors are going to be at play when it comes to our overall health as we age, not just our brain health. Our genetics, our propensity for certain diseases that we inherited in our DNA. That certainly plays a role, but research does show that's a pretty small factor overall, not for any one individual person, but in the population at large. Our genetics are a pretty small piece of the puzzle. So our disease risk factors, which could come from our genes, but could also come from our lifestyle, our environment, right? All of these other things contribute to our risk of things like heart disease, Alzheimer's disease, certain types of cancer, right? So our environment certainly plays a role. Our culture, how we feel about aging, affects how well we're going to age, right? What our experience of the aging process is going to be. Sorry to say that in the United States, we don't have a very positive, age-positive culture. So most of us are taught from a very young age to think that getting older is a bad thing. That is shifting a little bit. It's becoming more positive, happily. But at the moment, most of us, when we start to feel these normal age-related changes happening to us, we think negatively about that, and that negativity sort of feeds itself. So your culture has a lot to do with how you're going to age. But certainly there are other more sort of direct factors, like the kind of work that you did. If you were exposed to, physical injury, the risk of injury, chemical exposure, certain jobs certainly are going to have an impact, positive or negative, on how a person ages, as well as education. We'll get more into this interesting topic a little bit later in the program, but there is evidence that people with more years of formal education tend to have better health as they age. There's a lot of different factors at play in that, right? Some of it has to do with access to healthcare, the cleanness of the water that a person drinks, the air a person breathes, right? There's a lot at play there. It's not simply a matter of education having a good effect on your brain or your physical body, but there is a little bit of that as well. So mostly what we're here to talk about is lifestyle and controllable factors. We can't do much about all this other stuff, but we can do something about how we live our daily lives. So that's what we'll focus on here today. So for your overall health, these are the general recommendations. I won't spend a lot of time on this. It's not to say that doing any of these things is easy, or that we all necessarily know how to do them. But we all mostly, if you're here today in this class on maintaining your brain health, you've probably heard that most of these things are important already, right? It's kind of common sense to most of us. So we're not going to focus here, but I want to kind of run through it, right? For your overall health, and this applies to your brain health as well, you want to manage those numbers, things like your blood sugar, your blood pressure, keeping it under control, keeping it in a healthy range, managing your cholesterol, right? The bad cholesterol, your body mass index, right? It's just generally, we don't look at weight so much anymore. We look at body mass index instead. So keeping those numbers within healthy ranges is important to overall health. Not smoking. Of course, if you have been a smoker, not smoking, actually, there's really a lot of evidence that stopping at any stage of the game, at any age, no matter how many years you've been smoking, can really improve your overall health. So smoking cessation, or of course, avoiding it altogether if it's not too late for that. Managing your mental health. There are very clear associations between anxiety and depression and a person's overall health, including their brain health. And addressing sensory loss. This is a very interesting new area of research, but there's lots of evidence that long-term untreated hearing loss has many health implications. It increases fall risk, and it certainly does increase your risk of developing dementia. So getting your eyesight corrected, addressing hearing loss, which is very common as we age. These things are important to our overall health. But for brain health, here's what we're focusing on today. Staying active, getting plenty of exercise, staying moving, whatever that means to you, eating a healthy diet. And we're gonna go through each of these topics in some detail, but eating a nutritious diet, staying cognitively active and engaged, staying socially active and engaged, and focusing on relaxation, managing stress, and improving one's sleep. I say improving because almost all of us need to improve our sleep. It's the rare person who has really healthy sleep in the United States today, unfortunately. So with that, I'm going to ask Nellie to come on. Nellie, I will hand you the remote control and let you take it away.
Thank you, Amy. Let's see if we can get this to work here, everyone. I'm going to be helping us all take a look at some of the common symptoms of dementia, and then how do they differ from the normal age-related changes, some of which you kind of already got a little bit of information on. So let's move forward here and see if we can work together to learning a little bit more about this. Bear with me here. There we go. So Amy did share with us a little bit about how we don't really see the changes that are going on in the brain. And this little image here kind of gives us an idea of how those changes happen in our brain as far as they relate to dementia. So before we get going, I do want to share with you what exactly is dementia? What are we talking about? And what does it really entail? Well, dementia it's actually a group of symptoms that are actually caused by an underlying medical condition. And it impairs the cognitive function, but it also interferes with normal daily living activities. Now, Alzheimer's disease is the most common type of dementia, and it's a progressive degenerative disease of the brain. And here in this image that I have here on this slide, on the left side, we actually see what a healthy brain would look like. And then on the right side, we see what a brain disease with the Alzheimer's type of dementia might look like. So again, just back to what Amy mentioned, we don't get to see what's going on in the brain and how it's changing, but this image actually gives us an idea of how the Alzheimer's disease is starting to affect the brain and actually changing the size of it. Let's take a little bit closer look at trying to understand what some normal age-related changes are in comparison to some changes that we may recognize that might be something to be concerned about and could possibly be a symptom of dementia. So as we age, we are going to be coming into some slower thinking, and it may take us a little bit longer to recognize or recall what somebody's name is, or we might find that we're misplacing objects. But the biggest difference is that with normal aging, we're able to recognize or think about where we were and where we possibly left this object, or what it is that we lost, or we're able to later think of what the name of the person is, or that we couldn't recall at the time that we ran into the person. And the biggest difference is that with somebody that's possibly having a symptom of dementia or something to be concerned about is you might find that the individual is getting lost in familiar places and not being able to recognize. It could be out in the community. It could be their local neighborhood where they took that afternoon walk all the time and just not recognizing how to get back, or understanding how to retrace their steps. Forgetting the function of the objects is very different than actually misplacing them. Having the keys in your hand and being able to retrace your steps to say, oh, yes, I recall I actually left them in the door when I came in last, is very different than having the keys in your hand and not knowing that the keys are what are they used for, and that they actually are used to open a door, or that they actually are used to start your vehicle. So that's the biggest difference, is just not being able to recognize what the object is actually used for and its function. As far as thinking is concerned, Amy did also mention that we are still able to learn. However, we just may find ourselves doing it a little bit slower. And like she mentioned, we might find that we are not able to have everyone talking in the vehicle when we're driving because we need to focus to figure out where it is that we're going. That's very much different than the symptom that may be possibly associated with dementia, in just finding that there's more difficult with planning and sequencing. For example, in cooking or even back to driving itself, there is a process that needs to go into putting in order the steps that you need to take to put together the meal, or the steps that you need to take while you're driving the vehicle. So the sequencing is not as easy, and you're not able to clearly understand what needs to be done and in what order. And with this, think about what Amy said. You know, we can continue to learn throughout life, and continue to engage in learning activities. But when somebody's possibly having a symptom of the dementia, it's not so easily done, because as you think you might be able to learn a new instrument, but they're not easily able to retain the information. So actually, even though they're going through the motions, they're not learning and retaining that information because it's so new. And again, that's very much different than what we were talking about earlier as lifelong learning, where we're actually may take us longer, but we're able to retain those new skills that we're going through in steps and learning and retaining there. As far as physical changes, we do see that we're all experience some kind of maybe loss in our hearing. You'll see that a majority of us are going to lose or have some changes in our eyesight, and find that we're having to wear glasses, or that we're increasing the font screen on our computers, or adjusting the TV so we can see it better. In comparison to something that's changing, where you might be concerned about a possible symptom, you might think about realizing that it's a smaller peripheral vision that comes to become a concern, because a person with dementia will not have as big a peripheral vision as we typically do, and the narrowing of the peripheral vision makes it more difficult, and a higher risk with not only balance but falls, as it becomes more difficult to recognize contrast, or just to really realize how far something is from the person, or to the person may not have the ability any longer to really be able to, for example, reach down to pick something up if it falls, without losing their balance, and just the gait, which is the balance of the body, not being as best as it was before. And just again, putting that person more at risk, not only for falls, but for injuries overall. Behavior. This is something really interesting, because typically, however you are now, and the kind of person that someone has been their entire life, whether they're a person that's really engaged and just have a real bubbly or friendly personality, will typically stay the same throughout their life. Now, if you notice that you or someone has a change in mood, or again, the personality is changing, that's something that's not typical, and something to perhaps be concerned about or ask about. Also, if you find that somebody is no longer interested in really engaging in activities, or finding that the person is isolating themselves and just not as friendly toward keeping themselves active, is something to possibly be concerned about. Again, social withdrawal, maybe not. If this person was a person that was always in contact with their friends, or participating in community activities, maybe they were the person that organized the walk group in their neighborhood, you're finding that the person is changing and just not showing such interest in things such as that. Something to be concerned about, because typically, again, to keep in mind that the way we kind of are over our life, as far as friendly and interest and our personality, stays the same. So let's talk about what are some risk factors for dementia, because even though there are some things that we can control, and we'll kind of get to that here in a little bit. Let's look at some of the things that are risk factors for dementia that we may not really be aware of. So age is the primary risk for dementia, especially for the Alzheimer's type of dementia. And the older we are, the more at risk we are for developing dementia. It's the primary risk factors, and 1 in 9 person over the age of 65 will develop, could possibly have some type of dementia. Being female also is a risk factor for the Alzheimer's type of dementia. And although males do develop other types of dementia with greater frequency than females, genetics also is a risk factor for dementia, and family history does also determine a bit of your personal risk factor as well, because having a first-degree family member, a parent, or a sibling could raise your risk of having dementia. Now, dementia is not typically inherited the way we would think. Something is inherited, but again, it is part of a risk factor there. And head trauma is strongly linked to dementia as well. Some possible ways that someone might not realize how head trauma can come about. Think about having some type of injury, or, for example, those individuals that are involved in some type of professional sport might experience some kind of head trauma, boxing, football players. And it doesn't necessarily have to be professional. Any type of sport that could cause a head trauma could raise the risk factor there as far as that's concerned. Head trauma could also come to those individuals that are serving in the military or have served in the military in the past, could experience some type of head trauma that way as well. Well, let's go back a little bit and look at other possible health conditions that could be considered risk factors. Hypertension, heart disease, type 2 diabetes, or as Amy briefly mentioned, some untreated hearing loss can also be a risk factor of dementia. Now, Down syndrome is something that's you may not think, how is that associated with being a risk factor? Well, people with Down syndrome are actually at a very high risk of developing dementia as they age because they have that extra copy of the 21st chromosome. And this extra copy is what causes the brain to overproduce the proteins that's actually associated with Alzheimer's disease. And over 50% will show the symptoms of Alzheimer's disease. In fact, most people with Down syndrome, they have the markers of Alzheimer's disease in their brains by about the time they're 40. And many will actually go on to develop Alzheimer's disease. Now, there are significant ethnicity disparities with Alzheimer's disease, and most are prevalent. Alzheimer's disease is most prevalent among African Americans and the Latinx population, then among whites. And these disparities are related to other health disparities in the United States, including higher rates of, just like we mentioned, the conditions of health disease and diabetes. Now, there is no definite evidence yet about what can prevent Alzheimer's or age-related cognitive decline. And I think that's so important for us to keep in mind because, like Amy mentioned, we're going to be talking here a little bit about what we can all do to help each other incorporate better practices so that we can have healthier living styles and just healthier and better habits to take care of ourselves as well and our health overall. Just for a minute to take any questions we might have, and we'll have Amy and Ellen come back on with us.
Actually does not look like there are any just yet, so I'll just keep us moving in the meantime. But if you have questions, please go ahead and type them in the Q&A, or if more come up for you, we are going to take a second. We have time for a second Q&A pause, so we will do that in a little bit. But we'll just keep moving for now. So thank you, Nellie. Take the remote control back. Okay, here we go. So I'm going to talk now about what we know about how to address these risks that Nellie just described well for us. What are the lifestyle factors that are associated with reducing the risk of experiencing cognitive decline as you age? And I just want to acknowledge that's a mouthful. It's a lot of words. And what you might be noticing is that we're talking around the notion of prevention. There is, as Nellie just quoted, there is no known means of prevention. We're talking about lowering risk. There's plenty of anecdotal evidence. There are plenty of best-selling books out there that can tell us how to prevent these diseases. There simply is not large-scale, longitudinal, validated research that really demonstrates clearly what we can do to prevent Alzheimer's disease or other types of dementia. But there is lots of reason, many reasons to be optimistic, and many things that we do know. There is research, and that's what we're talking through here today. There is research about what we can do to maintain our brain health as well as lower risk. And chief among them is being active. It's not to say that this is the most important of the lifestyle factors when it comes to lowering your risk of cognitive decline or lowering your risk of developing dementia. When we get there, we'll talk about what we believe to be the most important of them. But this is a critically important one, and it's chief among them because there's so much evidence in this area. People have done a lot of research in this area, and there is very, very clear evidence that staying physically active is directly related to our overall health as well as our brain health. So staying active, it keeps blood moving through that all-important cardiovascular system. It's keeping the blood vessels strong. It's making the blood vessels larger. There's more of them. It keeps them growing, and it's increasing the amount of blood that is flowing to your brain. Right? I mentioned before, your brain is the biggest user of your blood supply. About 25% of every pump of your heart, it's trying to get blood up into your brain. So the more activity you're getting during the day, the more movement, blood circulation you're keeping going in there. Pretty intuitive stuff. But it also, what research does show is that physical activity stimulates the brain's ability to maintain those neural connections. Remember, I was talking about synapses, the electrical connections between the nerve endings at the end of our brain cells. Exercise, regular aerobic activity, right? Aerobic activity being that which elevates your heart rate, is shown pretty clearly to help us maintain those neural connections and even to help us create new ones. So when we get to the topic of cognitively stimulating activities, I think you'll see the relationship there. It's also known to raise the level of nerve growth factor in our brain, which is very interesting, sort of because there is research going on around the brain's ability to develop new brain cells well into our old age. We're not totally clear on that just yet. But what we do know is that exercise, good regular physical activity, increases the amount of growth factor in our brain. There's also neat evidence that people who engage in endurance activities, so going for long walks, long hikes, long bike rides, long swims, whatever that might mean for you, a sustained amount of aerobic activity, those folks have a larger hippocampal region of the brain. The hippocampus, you might recall when Nellie was reviewing that image of a healthy brain versus a damaged brain late in the progression of Alzheimer's disease. The hippocampal region is right at the center of the brain. It is where Alzheimer's disease tends to start. It is the part of our brain that is most deeply, earliest and most deeply affected by the plaques and tangles of Alzheimer's disease. So people who get more exercise, get more aerobic exercise, have larger hippocampal volume. It's not to say they won't get dementia, but it is interesting evidence of one of the many benefits of staying physically active. So I think the thing about exercise is that it also it improves our sleep, which is a really, really important part of our overall health, as well as our brain health. It helps with mental health, right? There's lots of evidence of the benefits of being physically active and anxiety symptoms and depression symptom management. So exercise is this wonderful foundational activity that's pretty accessible to most people, no matter where you live, no matter your physical ability. And there's nothing but positive research associated with the benefits of it. So what is recommended, by the federal government's guidelines for the average adult, so take that with a grain of salt, is 150 minutes of aerobic activity per week. That can be split up over 7 days, 22 minutes a day, or that could be split up over, 5 days, 30 minutes of exercise. It could be 5 and 10 minute chunks here and there. Plentiful evidence that you don't have to be an endurance athlete to get the benefits of physical activity. Aerobic activity, what that means is that your heart rate is elevated. So what's useful activity is different for every individual person, right? For some people, it takes a very intense Zumba class, right, to get your heart rate up to the level where you're going to get that benefit. For some people, it's very gentle chair exercises. So everybody's on their own sort of scale here. So we do want you to talk with your own healthcare provider about what type of exercise would be best for you, how to sustain that. But I would say the easiest solution is do the type of exercise that you'll stick with, that you enjoy. And as you'll see, if you can find an activity that you can do with other people, the benefits will be only impacted. I want to point out that later in the spring, on May 12th, we are going to be doing a program on using movement and motion for quality of life. This is a program, we call it a caregiver skills clinic. We do skills clinics about every quarter throughout the year on a variety of different topics, teaching family caregivers how, techniques for caring for a person who's living with dementia. There is ample evidence that exercise is actually as effective as medication when it comes to managing the symptoms of dementia. So in terms of, and I'm talking specifically about drugs like Aricept, Namenda, I'm not talking about psychotropic medications. So in terms of maintaining memory, maintaining thinking skills, problem-solving skills, exercise is deeply impactful for people with dementia as well. So May 12th, using movement and motion for quality of life, you can find that webinar on our education page if you're interested, if you're a caregiver and you're interested to sign up for that one. Talk a little bit about diet, or to be more accurate, we're talking about staying nourished, right? Nourishment rather than diet, I think is my preferred terminology. Staying well nourished means eating plenty of a wide variety, fruits, vegetables, grains. I know that's a controversial one. Fish, there's no one particular diet that is strongly recommended for the reduction of risk of Alzheimer's disease, with one exception. Generally, the guidance is eat a wide range of natural food, right? Real food, not processed food, not lots of trans fats. Eat a wide variety of food, drink plenty of water, and call it good, right? But there is one diet, the Mediterranean diet in particular, has been studied extensively. In particular, a variation of the Mediterranean diet called the MIND diet, which is a combination of the Mediterranean diet and what's known as the DASH diet, which is a cardiovascular diet. The MIND diet has been well studied, and it's pretty clearly, the research is pretty definitive that it does have a positive impact on overall health, on brain health, and on reducing the risk of developing dementia. So we still can't call it preventative, but every reason to incorporate more elements of the Mediterranean diet into your existing diet if you don't already. So what's the Mediterranean diet all about? It is not a low-fat diet. I want to be clear about that. It's not a high-fat diet, but it is not exceptionally low. There's plenty of fat in a brain healthy diet, but it's good fat. Right? So what do we mean by good fat? It's fats that are unsaturated, that come from plant sources primarily, rather than animal sources, or certainly from factories, right? From trans fats. So plenty of vegetables, plenty of fruits, those whole grains, whole grain cereals, if you eat them, getting more of your protein and fiber from legumes rather than relying on meat as a primary protein source. Legumes being, beans and lentils, those types of things. Fish. Fish is very high in the omegas that our brain needs for good, healthy function. The extremely low fat diets that were popular a couple of decades ago have turned out to have a pretty negative impact on our brain health overall. I'm not implying that low fat diets have led to an epidemic of Alzheimer's disease or anything like that. That's just to say we have seen negative impact on brain health in the research related to extremely low fat diets. So getting your fats from olive oils, nuts, seeds, other types of oils as well. Back to the topic of fish. Sometimes people wonder what kind of fish is best. We have this nice little, I'm forgetting the word for this, a device for remembering the cold water fatty fish are the type that have the most of these brain healthy fats that our bodies need. So SMASH is what we use to remember these 5 key fatty cold water fish that are exceptionally good for our brain health. So salmon, mackerel, anchovies. Now, anchovies are often packed in lots of salt and oil, so you have to consider how you're getting your anchovies. Sardines as well often come packed in lots of salt and oil, so look for the ones that come in water. And herring, a surprising one for a lot of people. So these are the prime, it's an easy way to remember the healthiest of the brain healthy fish. But if you like fish, eat any kind of fish. That's really what this all sort of comes back to, as with exercise, right? You want to do the kind that you enjoy. So too with food. If you don't like fish, don't eat fish, right? You can find other ways to get those omega-3s into your diet. Flax seeds, there are other ways to do that aside from eating fish. So as you can see, we're not recommending necessarily a vegan diet, a vegetarian diet, although those are wonderful as well. There's many benefits to doing that. So eating in moderation, eating in a way that is enjoyable to you. Quality of life matters a whole lot when it comes to your brain health. Eating foods that are enjoyable to you, that are accessible to you, right? Not all of these foods are affordable for everyone. So finding a way to craft your own brain healthy diets is what it's all about. Lots of questions about alcohol out there. Moderate amounts of alcohol, the research is pretty clear when it comes specifically to brain health. I am not talking about other types of disease. But when it comes to brain health, moderate amounts of alcohol are actually shown to have a positive impact on our brain health. Moderate is, sort of person specific. Generally, it's about 1 drink a day or less for women, 2 drinks a day or less for men. Moderate amounts of alcohol consumption are associated with good brain health, but it is also important to note there are many other health factors, health risks associated with drinking alcohol. On the whole, right, it increases your risk of cancer, certainly mental health conditions, addiction. There are many downsides to alcohol, but it is associated with good brain brain health. So that is, of course, a personal decision like all of these, and something you would want to talk through with your own provider about. Keeping the amount of saturated fat in your diet to a minimum, keeping the amount of dairy, meat, and poultry in your diet to a minimum. But again, not necessarily advocating for any particular diet. Just incorporating elements of the Mediterranean diet is what's associated with better brain health. Oh, I see in the chat, somebody gave me the word, a mnemonic device. Thank you for remembering SMASH. Struggling with that word. And finally, staying well hydrated. Your body is made up of lots of water. It needs lots of water to stay healthy. Staying well hydrated is also a really important part of staying well nourished overall. If you're getting plenty of exercise, then you need to be giving your body the hydration that it needs for that. But generally just remembering that our thirst sensors, remember when I was talking about as we age, our sensory processing dulls a little bit. One of the big symptoms there is our ability to detect that we are thirsty. Strangely, it changes, it declines as we get older. So the fact that you don't feel thirsty does not mean that you're not dehydrated. So we have to make a conscious effort to keep plenty of water or other, fluids coming in on a regular basis. So I will hand things back to Nellie. I'm going to give you the remote control again.
Okay, let's see. One thing that stood out to me, Amy, that you mentioned among all of that is the word enjoyable. And that's kind of what I want you to keep in mind as we move forward, talking about some activity for our cognition. And the way I kind of like to think about it is almost as those 150 minutes that are suggested for us to do some movement for ourselves throughout the week. I also like to think cognitive activity as almost exercising our brain, and just really trying to understand the importance of finding some joyful things that inspire us and keep us engaged to stimulate our cognition, right? And to be able to use these activities to establish cognitive reserve. And what does that cognitive reserve actually mean? Well, what happens is when we are engaging in an activity, the possibility of our brain being able to function effectively and just to go in there and even compensate for what has already been damaged, and being able to utilize that ability to stimulate our cognition by engaging in activities that are allowing us to try something new and try to, again, go through the steps of learning a new skill and just challenging us to be able to remember that information and enjoy it while we're doing it, and to be able to engage in lifelong learning at the same time. And I think that's why one of the reasons why I always try to hang on to that word enjoyable, because we're not suggesting you go out and try a bunch of different activities just for the sake of being engaged, but find something that is enjoyable to you so that you can explore it. And while you're doing it, you're more likely to do it for longer periods of time, or you might more likely to do it and include it as your new practice go-to in your lifestyle as well. Because we got to remember that engaging in lifelong learning and staying mentally active, it encourages blood flow to the brain, and it just promotes new pathways and brain connections as well. And these mentally stimulated activities may possibly maintain or even improve our cognition, like I mentioned, the cognitive reserve. And whether it be these activities that you're finding that you have done in the past and just now bringing them back to your practice, things like reading a book or playing a strategy game, could be something like I mentioned, learning a new skill or trying a new hobby. taking a class to challenge your brain with new information, whatever that might be. The good thing about it is us having so many programs online is that it gives us a chance to actually check things out on our own and kind of explore and see what's out there or what might be of interest to me that I'm really not sure of. So that's a good thing about there's being so many programs online right now, including this one, right? That we can come on here and kind of share some time and pick up some information that gives us a chance to think about it and see where do we want to go with it or how do we want to use it to apply to our learning and learning something new. And it also gives us a chance to figure out how we might be able to learn other ways to explore using our other 5 senses as well, so that we can also give it some strength and support to those as well, right? Because we want to try things that, again, are meaningful and that gives us some kind of purpose to see what is it we want to move forward to not only let ourselves be a part of, maybe engage in connecting with others as well. Bear with me here. So let's move on to talking a little bit more about connecting with others, like I mentioned. Social connection is so important, not only even more so now that we've already been spending so much time going through this time of pandemic together, right? Research has been found that the better relationships we have with others and the more frequent we engage in social activity, the better our cognition function will be. The reason why we think about the social connection being so important is because if we're more likely to start having better practices and even want to engage more socially if we're sharing that experience with somebody else. Because if you're sharing a good habit with somebody and just having a good time, you start including it in as part of your lifestyle, because who doesn't want to have a good time? Who doesn't want to be joyful, right? And when this happens, and again, we start incorporating better life practices, not only for our cognition, but for our overall health as well. And we tend to not only share more time with each other, but to start thinking about how to include better eating in our life, or how to actually incorporate other healthier habits in our life as well, including exercise, which again is such an important change and something that we need to work on implementing to continue to live healthier. Now, something that Amy did mention that stands out to me as well is that we can all benefit from having more sleep and relaxation, and that nobody really has a perfect sleep pattern or maybe a sleep practice. But let's take some time to talk about what might be helpful, what it should look like, and how we can start all moving toward even developing a better sleep hygiene routine, because poor sleep is something that increases the risk of Alzheimer's disease. And by starting to establish a routine, it gets us ready for bedtime, right? So that we can sense when we are going to prepare to have that time of relaxation. So how can we do that? Well, let's take a look here. You maybe want to consider setting some time aside to decide how you can create a peaceful mood in your evening. So start, like we say, pre-planning. How are you going to get yourself ready for bed? Consider keeping your lights low to set your mood, maybe. That might be helpful. Think about how to reduce the noise level. I know we were talking earlier amongst us on how we realized that on Saturday mornings, there's not so much action and noise going out in our community with, the trash trucks, the gardeners, people playing their music. So start considering the noise level and how you might want to be, how you might be able to reduce it, not only for you, but just in your home overall. If you decide to play some music, consider playing some soothing, relaxing music that is enjoyable to you. And as this pre-bedtime routine is established, just consider it to begin at the same time, just to develop again that consistent bedtime and to get prepared for your evening there. And in preparation for the evening routine, of course, it's helpful to limit your naps during the day, reduce the intake of caffeine, and replace it with more water, right? Because we all definitely need to work on staying more hydrated. Reduce as well the use of alcohol. Explore other ways to just cycle down from your day and how you might find certain things to be helpful in you actually relaxing. Maybe reading out loud may be something that you might want to try. And again, we mentioned the importance of exercise or movement. Why is this so important? Because this also helps us just develop a better sleeping pattern as well, and just helps us relax overall a lot better than if we don't have enough movement. Again, we all do want to try and get 7 to 9 hours of sleep as possible, but that doesn't mean you're going to go to bed and you're going to sleep 7 to 9 hours straight. Because as we get older, we are generally not going to sleep 7 to 9 hours straight. But we want to make sure that what we consider and what we keep in mind is that we want to be able to give our bodies enough time to get through those sleep cycles when we are having those 7 or to 9 hours of sleep, that we're really working toward getting through the sleep cycles. It's not so much us sleeping 7 to 9 hours straight. Because we also want to mention to you that evenings can be hard for people with Alzheimer's disease. Some may even become restless in the evening or even around dinner time. It's what we refer to as sundowning. And it's just another reason for us to really work on developing a better sleep routine, and just a sleep hygiene routine that might allow us to actually work through those sleep cycles. So let's move on to talk a little bit about some things that you might want to keep in mind as far as other conditions that are actually treatable, and conditions which also can cause memory or cognitive changes. Many older adults do have memory loss, but they never receive the proper medical attention that it's necessary to really better understand this. And also keep in mind that these medical conditions that can possibly cause memory or cognitive change can include things such as medication. Sometimes medication can cause individuals to just feel groggier or more tired, or give them a sense of confusion if they're not taking properly, or maybe it's just too much for the individual, and something that you need to just discuss or note with your doctor as well. Depression, some people lose interest in others and they become confused when they get depressed. And depression medication might be something that you discuss with your doctor if that's something that you think that you're interested or want to learn more about. Other illnesses or infections can also seem to cause memory loss or some changes in cognition. Having a urinary tract infection sometimes can cause confusion, and something that we don't think about. Another reason why it's so important for us to stay hydrated, right? Again, if you're concerned or you're really not sure, we would encourage you to really talk with your healthcare provider or share your concern with somebody else that might be able to give you some guidance or some support on how to collect more information about it as well. And also, to actually be able to possibly seek some type of diagnosis that might be able to give you a better understanding of what is going on or why you're possibly seeing these changes that may be occurring or these symptoms. For disease information, we've shared these websites with you, and we just want to remind you that these are some credible websites. And again, you don't have to worry about writing all these down because we are going to be sending the slides out to you, but we do want to invite you to, feel comfortable with going on here to learn more about the disease and possibly share with others if there's somebody else in and around you that possibly want to take some time to learn a little bit more about how they can help themselves or maybe help somebody else in their life by visiting these websites and learning a little bit more. Again, I do want to remind you they're credible, and that's something that we always want to keep in mind when we're out there learning about diseases and just collecting more information as well. Bear with me here. All right, looks like we're up for our little question break. We're going to see if we have any questions. Ellen, do you see anything there that we can take a look at or bring up?
Yes, actually, there are questions about medication in two different ways. First of all, someone is asking if medication used in anesthesia can impact memory loss. And then someone else is asking, are there medications that can be prescribed that help with the memory loss? Are there new medications? And why do doctors prescribe them if they don't work?
Ooh, that's a whole lot of questions. Yeah.
I know. All
Let's
about
see.
medication.
Sure. So just prompt us, Ellen, if we forget one of those, but let me start with anesthesia. Yes, absolutely. The medications that are used in anesthesia do almost universally produce at least some short-term memory loss in nearly everybody. That's pretty normal, but something that does happen in older adults or people who are already experiencing some cognitive decline or have other types of what they call medical frailty. When those folks go under full anesthesia, general anesthesia, we will frequently see some long-term effects. It's not always, it's not to say you shouldn't have a medical procedure that will require general anesthesia, but it is a risk. So we do sometimes see people once they come out of the fog that comes along with general anesthesia, they are a little bit set back in terms of their memory, their cognitive function overall. I'm talking again about quite older adults, as well as people who have already started experiencing some brain changes. So there's that. Are there medications that are known to improve memory? Was that the second question?
Yes. Mm-hmm.
Okay. I don't know. I mean, I've got an answer there, but Nellie, do you want to take that one?
Correct me if I'm wrong, but I don't think we can look at medications as actually improving memory. I think we need to just keep in mind that there's some medications that will actually help with the symptoms, not necessarily improve the memory. I think that would be the biggest difference to keep in mind there.
Yeah, I think that sounds exactly right to me. That's how I like to think about and talk about the medications that are available. So there are a few FDA approved medications that have been approved for use in people with Alzheimer's disease that are sometimes used in other types of dementia as well. They're sometimes called memory drugs. They are not shown to improve memory in people with mild cognitive impairment or other types of dementia. But what they are shown to do in some people, not in everyone, is to delay the progression of memory changes and cognitive changes. So even in, these drugs are like Aricept and Namenda, Exelon, Razadine, if you've heard those brand names. Aricept and Namenda in particular are pretty heavily advertised. So you've probably heard of those two. They are also the two most commonly prescribed medications for people with Alzheimer's disease, but they don't work for everyone. And why are they prescribed if they don't work for everyone? Because they're all we have. And doctors have very little at their disposal. That's not really a great answer, medically speaking, but for a lot of physicians and a lot of individuals, it's like, well, let's try this one and see if it works. How do you know if it works? If it doesn't improve your memory, how do you know, right? It's really, it's a challenging gray area there. So what they are shown to do is delay the worsening of symptoms in people who have already started experiencing early cognitive decline, early memory changes. But how would you know as an individual person what your changes would look like if you didn't take that medication? There is no way to know. That's broad scale sort of data that tells us that. So I think the research is that about 50% or so of people who take these medications will see kind of a stabilizing, a leveling off of the loss, a leveling off of the changes, but that decline will come later. Did that address all of those questions, Ellen?
It did. Very,
Okay.
very well done. And I will say somebody just added something in the chat recommending or providing a name of a supplement, an herbal supplement. Would you like to address that?
Sure. Herbal supplements are different from prescription medications, right? And so they're not regulated by the FDA. They aren't tested in the same way. We just don't have the same data around them. Not to say that they aren't helpful in some regards. Some herbal supplements have pretty well documented health benefits, but there aren't any particular supplements that are out there. Different vitamins, different herbs, they come under lots of different brand names. There aren't any supplements out there that, again, we have large scale validated data that tells us, yes, this will either prevent or improve, prevent memory loss or improve memory in folks that are living with dementia. Yeah.
One more question for you. Someone is asking about CBD, smoking gummies to help with stress and pain relief. And are there any studies, or what is the information on use of CBD for memory loss?
It's a really tough one. So because it's not federally legal, the amount of research that can be done on the use of cannabinoids is pretty limited. There are some studies being done, but they are pretty small scale and not yet conclusive. So lots of anecdotal evidence out there about the benefits of using CBD for sleep, for pain management, for the management of anxiety symptoms. There are some pretty well, I'd say, like not scientifically known, but widely known benefits to its use, but there is not yet good data out there about its impact on Alzheimer's disease risk, prevention, certainly, or even just how it can be used to improve memory. But I'd say there is this sort of associated relationship that we want to think about. And that is, I mentioned early on when I was talking about exercise, that while it's the most researched lifestyle factor, in my mind, it's not actually the most important. I would say sleep is number one. Nellie gave you some good information about sleep and good ways to improve your sleep. Sleep is sort of the foundation of all of this, right? You're not going to have the energy, the wherewithal to exercise, to eat a healthy diet, to get out there with your friends, to engage in new cognitively challenging activities. You need to be well rested in order to do any of that other stuff that's associated with good brain health. And so when I think about things like melatonin, when I think about things like CBD, right, there's lots of evidence that these things help people with their sleep. And so, that is an important health benefit overall and might be, a factor in being able to do more of these other things that improve your brain health, right? If you've got really bad pain that keeps you from exercising regularly, right, it would be important to address that pain in order to allow you to exercise more. So there is not good data about this, but it's certainly something, again, I'd say talk with your provider about if you're interested in pursuing that. Is there anything you'd add to that, Nellie?
Yeah, I think exactly what you said, just to, keep in mind where's your starting point where you're not going to be interested in trying all these other things to help you have a better life if you're not yet fully rested. And if it's not working out for you, yes, definitely bring it up to your doctor and talk about it. It's something that interests you. But I think what stands out to me about all these questions is just to really learn how to be a better consumer about what's out there, and just really continue to, look to better understand the disease and what might help it or what might help the symptoms by visiting some of these websites that we've going to be sharing for as a resource. Because as a consumer, there really is so much for us to learn how to really be a better consumer so that we can get the best information for us to live a healthier life. I think that's just really what I would add.
Thank you very much for your answers.
Yeah, that's it. Okay, great. Well, we'll keep moving on. Thanks, everyone. Great questions. Okay, here we go. So here we are. This is Alzheimer's San Diego, sort of in a quick visual snapshot, if you will. We are a local nonprofit, as I mentioned before. We're based in San Diego, and our services are free and open to anyone who is impacted by dementia. That's people who are concerned about dementia, people who are caring for someone with dementia, and of course, people who are living with dementia, whether you're in San Diego County or not. So we are a local organization. That is our mission, right? But certainly we know there are folks participating from everywhere. So we offer an array of support here to folks that are living in San Diego County and who can access things virtually. We have support groups. We have dozens of different support groups for different kinds of caregivers. They're all meeting virtually at the moment. We hope to resume some in-person support groups in the near future, but quite safe enough here in San Diego to do that just yet, but we're getting close. You have obviously found our online education and training program. We do offer regular live webinars as well as an extensive array of recorded programs in our webinar library on a host of topics. So thank you for joining us today, and let us know what other topics you want to learn more about. We have several great volunteer programs. One, of course, is our tech team, where volunteers like Jacob, who's with us here today, can help out with technology needs. If you are struggling with the use of technology to stay socially connected to long-distance family members, for example, our volunteers are here to help out with that. So we also have our ALS Companions Respite Program, where we pair screened and trained volunteers to provide in-home or virtual companionship to people that are living with dementia in order to give caregivers a little bit of a break. It's a respite program. We're not providing hands-on care, but we can also connect you to other resources for in-home care, adult day programs, memory care, if other types of respite are needed. But our volunteer ALS Companions program is for friendship. If any of these activities that we've been talking about, boy, it sounds great to learn to play a new card game or, get out and get some exercise. And I just don't have time. I can't get away to do those things. Our volunteers in the ALS Companions program can come. So we make a match. Once we find a good fit for you, that person sticks with you and becomes a consistent, regular weekly companion. So very proud of that program, as well as our Vitals program, Volunteers in Touch, who make phone calls to people with dementia who live alone and could use some regular check-in as well as socialization. So lots of great volunteer-led programs. We also are very involved in and supportive of the local research community. On our website, you can find information about local clinical trials. If you're interested in learning more, they are in need of subjects nationwide, but we have a lot of research happening here in our county. They're looking for subjects of all types, people who don't have any symptoms, as well as people who do. So if you're interested in finding out about more what's happening in local research, you can also join us at our annual Date with a Cure event. This year's is scheduled for Tuesday, June 14th, and information about that is up on our website, of course, on the education page, where every year we bring together scientists, representatives from who are doing active Alzheimer's disease and other types of dementia research here in San Diego County from the local research institutions. We bring them together and let you ask your questions. So if you've got questions about medications, about treatment options, about emerging technologies that you've heard about, this is a great way to get those questions answered, to hear right directly from the researchers themselves. So lots of opportunities to engage in research here in San Diego County. We have social activities to stay active and busy and get out into the community for people living with dementia and their care partners. And maybe most important of all is our team of dementia experts. So Ellen is just one of a whole team of amazing clinical care coaches who are here to answer questions, to connect you to resources, or just provide emotional support if you just need to talk to somebody about the changes that you're experiencing. So reach us in a whole variety of ways. Visit our website, you can call us, you can email us. We have live chat available on our website. That is actually a live person, a member of our team, when you see that there. You can also fill out a request form. I do see, yes, thank you, Ellen. She out in the chat, she has put a link to our, what we call our follow-up request form. If you fill that out, if there's a specific topic you want to get a little more information about that you heard about here today, or something else, right? A caregiving need, a resource need, you want to find out about local research opportunities, whatever it might be, fill that request form out and a member of our clinical services team will follow up with you next week to answer your questions or connect you to whatever it is that you need. We do have regular online education happening, as I mentioned before. Safety at Home will be taking place next week, next Wednesday, a program where we focus on ways to prevent accidents, falls, injuries, as well as issues like wandering, driving, medication safety. We get into all the tough stuff there in the Safety at Home program. And then the following week, Nellie will provide the same program in Spanish. If you have Spanish-speaking friends, family, colleagues who would benefit from this information, please let them know. And then the next skills clinic, I mentioned our May skills clinic earlier. The next one is on the topic of balance and fall prevention. So a great related topic to what we've been talking about here today. I'll be co-presenting that with a licensed physical therapist. So you'll hear directly from the expert there. So information about all of our education programs is on our website. When this webinar ends, you're going to get a link to a short survey. We would love your feedback. As I said, we're always interested to hear your comments on the program, but also other topics that you want to learn about. So those are anonymous. Please fill it out. We really we use and value your feedback greatly. So as Nellie mentioned, we're going to email out a copy of the slides we spoke from here today. You'll all receive that, as well as a link to our webinar library where you'll be able to find a recording of this program next week. So any other final questions or anything else, Ellen, that we should address before we wrap up?
We did just receive a question about Ambien increasing dementia risks. Is this true? Do you want to address talking about the importance of sleep?
Yeah, I can't say that that's not true. I haven't seen a particular study, a particular report on that. That's not to say that it's not true, right? New research is coming out all the time, but I do hear often physicians caution against the use of Ambien and medications like it, especially in people that are already experiencing some cognitive decline. It is associated with memory problems, that's for sure. But I don't know about its direct link to Alzheimer's disease or other types of dementia. I have not seen that, but again, there's studies out there that we miss. So yeah, that could very well be the case.
Thank you.
You bet. Well, thank you all for coming. Thank you, Ellen, for being with us here today, answering questions and sharing resources with folks. Thank you, Jacob, for your support to us and to all of our attendees today. We really appreciate that, keeping all the technical stuff running smoothly, very helpful. And of course, my thanks to Nellie for co-presenting with me and being here to share information with folks. Finally, our thanks, of course, to all of you for coming, giving us your Saturday. We appreciate that a lot. We hope to see you at another program again soon.